here.
Oh. Oh. That was a good one.
Chiro cracks. Chiropractics for everyone.
Neck pain, back pain.
Neck pain, back pain.
Which one's worse?
Pretty bad, both of them. I have a disc herniation in my cervical spine. I have a lot of pain that goes throughout my shoulder blades, specifically on the right side.
Do you ever get any pain that goes down your arms?
This side.
Left side. Numbness and tingling to your fingers? Which fingers does it affect?
The thumb and this finger.
Okay. Do you remember, was it just one disc in your neck?
I believe the MRI said C5 through C7.
Bulging or herniated?
Herniated.
How'd you do that?
Car accident.
When was that?
2013.
And then when was that MRI taken?
I've had a few. The last one was in 2018. They just told me to do surgery, which I'm not trying to do.
No PT? They didn't even offer it? Okay.
Change of diet to try to help inflammation.
What kind of diet changes did you make?
I went completely vegan, no dairy. I mean, I still don't eat dairy, but I didn't notice that much of a change because I just feel like I'm always tense. And I think that contributes to like a lot of muscle tightness that I experience in my back because I feel like I'm just all knots.
Okay. All right, tell me about your low back.
So that kind of has always given me problems, especially around my cycle. Like I feel like if I bend forward, it always pops or feels like it needs to pop, and it does like this. And then recently I had a CT scan because I've had a lot of digestive issues, and they checked my liver and my kidneys, and on that scan it showed that I have an L5 pars defect, which I didn't know what that meant. Apparently it's a fracture of some sort, so found that out because they never actually did an MRI of my complete spine. When the accident happened, they just did from like here. So who knows how long or what's going on completely.
Do you ever get any pain that goes down your legs?
I get a lot of pain in my calves. I don't know why.
Both calves equally?
The left more than the right.
Any numbness or tingling in your toes?
No.
Let's start with your spine, and it sounds pretty straightforward towards your spine, low back and neck, and then we'll look at your jaw too. So we're gonna do a gait analysis. We'll check out and see what your spine says, and then I'll get you adjusted, okay? Okay, looking at the feet first, heel strike, mid stance and toe off. Looks symmetrical. A little bit of inversion there on the left side. Yeah, definitely inversion in the last 3 left-footed steps right there. And then the mid stance on the right side is showing a little bit of pronation as well. All right, looking at the shoulder height, we have just very slightly mild increase on the left side. Left shoulder is a little bit higher. Not too much head tilt to compensate for that. That's good. And then from here, it looks like a high left hip. Looks like a high left hip. Hard to tell though with the black pants. That's okay. We're gonna come back this way, and then looking at the hip swing, it's pretty mild hip swinging there. Actually, I don't see any discrepancies.
I feel like the old lady when I sit down, like holding my back. I think since the fall happened, I've been trying to like hold onto my hips.
Okay, just looking at your spine posturally. So no one ever told you had any curvatures in your spine?
I was tested for scoliosis when I was a kid, but they didn't say anything. I feel like my spine is not straight, and especially there's like a hump. Some people have pointed that out.
You have a slight increase in your thoracic curve here. It's not terrible. But like, can you see, there you go. Like now you're good. But when you do that, I can see the compensation because these muscles here are sticking out way further than these muscles. So there's more tension here than here. Okay, I'm gonna do a gentle scan on the top of your spine. You have a lot of right-sided activity here. So when we do a temperature evaluation, the temperature is nice and symmetrically distributed from left to right, left to right, left to right. Even in this area where it's more tense here, it still feels even, but the moisture really picks up, and then it just becomes very moist here in the low back. You have any tenderness here?
Yes.
Which side more? Left and right, same? Not a whole lot of rotation, but the right hip might be stuck backwards, or the left hip is probably stuck forward. Okay, now I'm gonna bend your knees. Don't help me, let me do the work. Good. Right short stays short. That points to the left SI joint. Discomfort, tension, pain?
Oh yeah.
What about the right side? More on one side than the other?
More on this side, but they both hurt equally.
Okay. Pain, discomfort, tension.
A little tension.
L5, L4, pain, discomfort, tension. But it hurts the most when I push here?
Yes. Oh God, yes.
Coming in. Is this tender here?
It's tender. Oh.
We're gonna have to adjust your coccyx today. Do you still have that tension there?
That's not as bad.
How about the right side? Still have it there? Okay. Okay, let your shoulders relax. Tender. Which side's worse, left or right?
Left at the moment.
All right. Nice, gentle breathing. How's the pressure? Okay?
That's fine.
Gentle. Shoulders relaxed. All right, I want to give that one more little push just to make sure we got it all, okay? Okay, let's do that again. Deep breath in and out. Good. Shoulders relaxed. Good. Let's try this one here. Go and take a deep breath in. Good, and out. So we're going to follow, just like we did before, down to the coccyx. Tender? Come just underneath of this segment here. Good. Okay, let's try it. Go and take a deep breath in. Good. Okay, good. We're breathing. Following your breath, I'm going to bring your shoulders up here and this hips down. Then we're going to push like that, okay? Okay, go ahead and take a deep breath in and out. Good. Shoulders.
That was a good one.
Try to let me do the work, okay? Let me move your head. All you have to do is breathe and then just let your head drop. Good. Shoulders relaxed. Good, letting this go. Good, I'm gonna push this in here like this. Good. You're doing good. Good. Letting this go, letting this go. Let it go.
Oh, that feels so good.
Again, just let me do your
Okay, I'm so sorry.
Let me move your head. You don't have to do anything. All you have to do is breathe. Good.
That was it. That was a good one. Oh.
We're gonna start the ileocecal valve. We find that by first finding the belly button. Yours is like here. ASI is here. We connect these 2 points. That's where we begin looking. Yours is pretty easy to find. Weird.
My whole digestive system is honestly tender.
Good. Okay, now we're gonna use this towel. Are you okay with the towel like that? And just like the other adjustments, I'm following your breath.
Oh. Oh. It's an intense adjustment, that's for sure.
Taller. I feel like I'm standing up taller for sure. Neck feels not as tense. Hips don't feel as tight. Everything just feels loose.
Oh, it's crazy how much better my neck feels. Because when I was getting chiropractic care, like, they would just adjust my neck and poof, be gone. But it never ever, not especially not on that side, cracked like that. It would just be like a little crack and that was it. But that was deep.
Good. Good.
I'm just looking to kind of get some adjustments on like my back, neck. I'm looking to improve posture.
Okay. Do you have any discomfort in your neck?
Yes.
How often do you have it?
About 2 to 3 times a week.
How long has that been going on for?
A little over 2 years.
Did you have an accident or an injury that started your neck pain?
No, so I actually saw a doctor for it and they said it was like hyperextension.
Okay.
That's what they said. They said hyperextension, hyperflexibility.
How about back pain? Do you have any mid back or low back pain?
I'm on my feet a lot because I'm a nursing student. I'd say like lower back pain, but it's not enough to bother me.
Numbness or tingling in your fingertips?
No.
Do you have headaches ever?
Yes, I have chronic migraines. I made some lifestyle changes. Like I started working out, I started eating better, and that honestly like really helped me.
Have you ever been to a chiropractor before?
No. I'm actually excited.
All right, I'm going to do a temperature exam now with the backs of my fingers. Very symmetrical from left to right. This is a postural bump right here. If you don't watch your posture, then this will develop. All you have to do is keep your head like there. Push out against my arms. Push, push, relax. Left or right?
Left.
Tender?
Yes.
Do you have any tension, discomfort when I push there?
No.
Left side, any there?
No.
Here.
No.
I'm gonna follow your breath down like this. And at the end of your breath, we just give a little push like that. We're gonna go a little bit further than that. Deep breath in through your nose and out through your mouth. Let your shoulders sink in.
Wow.
Same thing. Deep breath in through your nose, out through your mouth. This one's a little bit different. This time, you're gonna breathe in, and then at the top of your breath is when we push. Lift your right leg in the air. Left leg. I'm going to bend your top leg like this. The bottom leg is straight. I'm going to scoop forward here just a little bit. I'm going to bring your hip down like this, and your shoulder goes in that direction like this. Right about there. We're just going to push in that direction. Turn your head to the right. Now to the left. All you have to do is breathe right now. Let me do all the work. You don't have to move. You don't have to help. I'm going to bring your head over to like right about here. And then from here, we just push in that direction. Let the head drop.
That was good.
Nice and gentle breathing. Gentle, relax, sinking in. Squeeze. So we start with the iliocecal valve and the ASIS, the front of the hip here. We connect these two places, and then right in the middle is the starting point tender.
Yeah.
From here we find the pyloric sphincter. From there we do the diaphragm maneuver. How much water do you drink?
Not enough.
We're going to pull in that direction. This is a full spine adjustment. Nice, gentle breathing.
Yeah, I felt it.
Do you experience back pain often?
Sometimes. Mostly, I guess, driving from a far distance and stuff. As for neck, it depends if I sleep awkwardly.
Okay.
Yeah.
All right. So how often do you think that you have the back pain from driving?
I would say maybe once a week.
Do you ever get any pain that goes down your arms, any numbness or tingling in your fingertips?
The only time would be if I sleep on it, I guess, or.
Okay, very good. Does your back pain ever go into like your hips or the back of your legs?
I would say if I'm sitting for too long, I guess it would be in my hips area and legs. Yeah.
Okay, very good. All right. Okay, do you ever get any numbness or tingling in your feet when you're having that hip and back tightness pain?
Yeah, I would say.
One more than the other, left or right?
I would say right.
Have you ever been to a chiropractor before?
No.
How do you feel about it?
I'm excited.
All right, so we'll go nice and slow. I'll explain everything that I'm doing while I'm doing it. We'll go through a bunch of exam procedures. Okay, looking at the feet first. I don't see any pronation or supination. And heel strike, mid stance, and toe off, normal and symmetrical. Okay, looking from the back, the feet still look symmetrical. I don't see any valgus or varum on the lower extremity. That's good. Shoulders high on the left with a little bit of a head tilt to the right. Good. Hip swing is accentuated to the right. Arch is mildly decreased bilaterally, but normal. And no valgus of the toe here, no bowing, no bunions of the toe. Turn around and face the other way. And then no arching of the Achilles tendon as well. Go ahead and turn around and face this way again. All right, put your hands on your hips. But I'm going to replace your hands with my fingers, so move your hands now. Hip is higher on the left. Okay, just observing the spine first. We're going to look at the height of the scapula. Good. Squeeze your shoulder blades back just a little bit. Good. Okay, now relax. Good. We do have a high left shoulder. I'm going to put my fingertips on the top of your hips. High left shoulder, high left hip. Okay, not much of a postural change here. This is good. You don't have like that humping here. Okay, I'm going to palpate the SI joints here. I'm going to lower your waist bench a little bit, okay? Okay, any tenderness here?
Yeah, a little bit.
Good. Any discomfort, tension here?
No.
Looking from the top, feet are even. Looking from the top, the left glute is coming out like this. So the left glute comes out like this. It's a little bit turned in this direction. And then possibly like this too. We'll have to see when you're laying down. Good, no rib humping here, no curvatures of your spine. Good. Just looking for very small movements in the posture while you're standing. Good, not much to the right or left. That's good. It kind of wants to dive off to that right side again. I can feel your body holding it though. And you feel yourself, do you favor one foot more than the other? Are you leaning into one foot more than the other?
Yeah.
Which side?
Right.
Okay, the right leg is shorter than the left. That confirms what we saw on the glute standing test. I'm going to bend your knees. Try not to help. Just let it all go. Right short crosses over, becomes the long leg. Okay, any tenderness, discomfort when I push here, right SI joint? Do you have any tenderness or discomfort when I push in the right SI?
A little bit.
Any tenderness, discomfort there? Nice, gentle breathing. Tiniest little spine cracks. Okay, this one's a little bit different. This time we push at the top of the breath, so you're going to take a deep breath in, and then at the top of the breath, as you start to breathe out, that's when we'll push. Go. Okay, deep breath in and out. Okay, so this is how we adjust the low back, okay? We're going to bend the top leg like this, good. Bottom leg stays straight. I'm going to scoot you forward here just a little bit to the end, and pull this shoulder out just a little bit like that. Nice and gentle breathing. Same thing, we need your shoulders to relax. I'm going to press your shoulders up in this direction like that. We're going to bring your hip down like this. Then we're going to push like that, okay? Good, deep breath in. And breathe out. Good. How did that feel?
Good.
Go ahead and turn your head to the right. Back to center. Good, now turn your head to the left. Center. But now bring your right ear down to your shoulder. Good, back to center. Left ear. Center. Okay, ready to get your neck cracked?
Yep.
Very gentle.
It was good.
Okay, that was good. We almost got all of it. There's two more left in there, though. There's two more. Go, let it go.
That was a good one.
Oh, yeah. Okay, squeeze. Heart. Did you feel it?
Yep. I heard it.
Is it tender in there?
Yeah.
I'm gonna use this towel to support your neck like this. You okay with that?
Yep.
Cool, good.
Heard that one.
Feel it all the way down?
Yep, up to here.
Go ahead and stand up. Take it for a test drive. See how it feels.
It's good.
Good. How's it feel?
Refreshing.
Mm-hmm.
Yes. There it is. I guess I feel more elastic. I didn't even know you could do that.
What can I help you with?
For some reason, this foot, I can crack it almost every hour. My hands, my back, I always crack my spine. And my neck.
Do you crack it every day?
Yes.
Do you crack it because it hurts?
I guess I just feel the stiffness.
How long have you been doing that for?
5 years. I got more involved in going to the gym, doing sports.
Do you ever have any pain?
Just the stiffness.
Numbness or tingling? Knees?
Nope.
Elbows? Shoulders? How's your digestive system?
Can't really complain. I mean, I try to eat really healthy, but as far as medicine, I really cannot take any pills. It just makes me feel not myself, I guess. I take vitamin D, magnesium, iron, vitamin A, fish oil.
Very good. How do you feel about getting adjusted today?
I can't wait to get adjusted.
Just like the slightest little curvature right here. Curvature here. More heat coming off the shoulder blade area. These muscles are working hard up here, but you have good posture. Do you always sit up straight like this, or is it just because you're at the chiropractor's office? The lumbar muscles here are very tense. Is that tender at all when I push into them?
Yeah, that area for some reason is very sensitive.
Does this feel the same left to right?
More discomfort on the right.
Let's check out the SI joints. Same, equal?
Equal.
Any pain here? Any tenderness?
Tenderness.
Good?
Yeah.
Turn to the left. Tender?
Mm-hmm.
Does it feel more restricted on this side?
This side is more restricted.
March in place. Muscle contraction is visible on the right. Looking from the back, slightly higher on the left, meaning possible GI ilium. Looking from the top, slightly external rotated on the right glute. No rib humping here. The lumbar curvature completely straightens out. Do you have any discomfort when I push there?
No.
Here?
No.
I'm gonna follow your breath down like this, and then when we get to the bottom of your breath, we push. It's ready to go. Let your whole body sink in.
That feels really good.
Sinking in gentle. One more at the very top, letting it all go. This one's a little bit different. You're gonna take a deep breath in, and at the top of the in-breath is when we push. Nice and gentle breathing. Let your shoulders sink. Lift this leg in the air. Left. Bottom leg stays straight. In this position from here, we're gonna stretch your shoulders like this, your hips down in this way. Bring your hips down. Breathing. Let the hips come down.
I honestly didn't know I had so many bones to crack.
Turn your head to the left. Bring your right ear down to your right shoulder. Bring your left ear to your left shoulder. I'm gonna bring your head over to the side like this. Right from here, we're gonna push in that direction, okay? Mm-hmm. Gentle.
Wow.
So one more on the left. Breathing softly.
Oh my God.
Breathing gently. Sinking in.
That feels awesome.
Push, push, relax. Squeeze. Nice, gentle breathing. Tender.
Ticklish.
Now the pyloric sphincter. This feels clear. When you breathe in, push your belly out. We're going to pull this up.
I have a lot of issues with my neck. I wake up with a lot of pain, especially in my neck. Same with my back. I kind of have some back issues.
Your neck hurts worse than your back?
Yes.
How long have you had neck pain for?
Ever since I was in college.
Was there an injury in college that you
I
can
don't
remember?
think so. A lot of my college work, I'm sitting up and I'm typing. So I think that stress on my neck is what's contributing to it a lot.
Do you still do that now?
Yes. It's every day, but it fluctuates. Sometimes it's more tolerable than other times.
Do you get any headaches?
Yes. All the time.
Where on your head does it hurt?
Around here.
Do you get nausea with it?
Yes.
How do you get rid of the headache?
I usually take Advil for it. I don't sleep a lot too. So I think that's one thing that contributes a lot to it.
Let's talk about the low back pain. How long have you noticed that for?
Only a couple months.
Any injury with your low back?
Nope.
Numbness or tingling in your legs or in your toes?
Sometimes. It doesn't happen often.
Do you take any pharmaceutical medication?
Yes. Anxiety medication.
Any birth control?
Yes. I'm a little nervous, but I'm excited and hope it will help me solve my problem.
Slight pronation on the right, moderate pronation on the left. Hip swing looks even on both sides from left to right. A little bit higher shoulder on the right. Less arm swing on the right too. I'm going to do a temperature evaluation with the back of my fingers. Very warm. Your entire spine. I'm going to push a little bit deeper into the muscles. Tender?
Mm-hmm.
Very tense muscles here in the lumbar spine. Let's check the SI joints. Do you have any tenderness here?
Mm-mm.
Here on this side?
Mm-mm.
Any tenderness there?
A little bit.
We are lower on the right, which means that the right hip has gone posterior and inferior. And looking from the top, we are more round on the right, which means it's gone posterior and inferior and externally rotated. Very good, nice and symmetrical, no rib humping. Push your feet out to the side. Push, push, relax. I'm gonna push down into your sacrum. Do you have any pain here?
Mm-mm.
Good, any pain here?
A little bit.
Any pain here?
No.
That's tender?
Yes.
Shoulders relaxed. Let your shoulders relax. I'm gonna follow your breath down like this. And then as we get to here, we're gonna give a little push like that, okay?
Mm-hmm.
Gentle, gentle, let everything sink in.
Oh my god.
Keep breathing. I'm following your breath. Let your shoulders sink.
Wow. That's amazing.
We're gonna bend the top leg. Bottom leg is straight. I'm gonna scoot you forward here just a little bit. As you breathe in, we're gonna bring your shoulders back like this. And I'm gonna bring your hips down like this. Shoulders relaxed.
That was a good one.
Same thing, we're gonna bring your hips up like that. Then we're gonna push your hips down in that direction. Breathing in through your nose, out through your mouth.
I love it.
Turn your head to the right. Now turn your head to the left. Bring your left ear down to your shoulder. Gentle breathing, just like before. I'm going to follow your breath. Let your head drop in here.
Wow. That was really good.
Let this go loose, loose. Now let your head drop in.
It doesn't hurt at all.
We're going to do a pubic bone adjustment first. You're going to squeeze my fist in between your knees.
That is crazy.
That was the loudest pubic bone crack I've ever heard. The iliocecal valve. Yours is almost directly in the middle, slightly inferior. Tender. Mm-hmm. Breathe into your belly. When you breathe in, try to push your belly up. Don't move this at all. Okay. Only move here. Breathe in, fill your belly up. Good. In, out. This is a full spine adjustment. I'm going to use this towel to support your cervical spine, like this. But make sure you keep your teeth together. As you breathe, I'm going to use the towel to traction your spine in that direction.
Oh my god.
Relax your head.
That was a little different. Wow. It's crazy.
You're gonna take a deep breath in and breathe into your sides. Like try to push my hands with your breath. Let the shoulders relax here. One more.
I've been doing long jump and triple jump in high school, so my knees kind of crack all the time. I could crack my elbows and my neck. It relieves so much tension. I've been doing it since 8th grade.
You said you get release or relief from it. So you have stress in your neck, tension, tightness,
Yeah.
numbness, or tingling in your fingertips or your arms.
And now I go to the gym and I'm taking a boxing class.
What do you use cannabis for?
Anxiety, and sometimes I'll get period cramps.
Have you ever been to a chiropractor before?
No.
Nervous? Excited?
I'm pretty excited.
Warmer here underneath of the right scapula than the left. There's like this tiny little rotation here. Okay, now let's rotate to the right. Let your hips relax here. Let your shoulders relax. Breathe softly. Nice gentle breathing, moving in the rhythm with your breath. Take a deep breath in. Then out through your mouth. I'm gonna follow your breath down like this. Sinking in, gentle, gentle. Nice and gentle breathing. Let yourself sink in here. Sinking in, gentle. Let's see what this guy says right here. This one's a little bit different. So you're gonna take a deep breath in, and then when you get to the top of the breath, that's when we'll adjust. Let your shoulders sink as you breathe out. Bend your top leg like this. Your bottom leg stays straight. I'll scoot you forward here to the front like that. Just let your head completely relax. We're gonna pull this out just a little bit. What we're gonna do here is I'm gonna bring your hips down like this and your shoulders up in that direction like this. And then right from about there is when we're gonna push. Breathing. It's pretty good. Okay, so this is how we check your neck. Turn your head to the right. Now to the left. Bring your right ear down to your right shoulder. Left ear to left shoulder. I'm gonna bring your head over to the side like this. And then right from here, we're gonna push in that direction. Nice and gentle. All you have to do is breathe. Shoulders sink in.
That was pretty impressive.
7, 6, 5. This is all stuff that you can crack on your own. So we need to adjust the very top on the left. Nice and gentle. Let your shoulders relax. Breathing. Squeeze. Good, relax. Push, push, relax. Hold them harder, stronger. So we start with the ileocecal valve here and your ASIS here. In between these two places usually indicates where the ileocecal valve is. So we're just gonna push into your belly here. Deep belly breathing. Next one is the pyloric sphincter. This is the place where the stomach empties into the small intestine. Tender. This is a diaphragm release. Belly breaths. I'm going to use this towel to support your cervical spine. Nice and gentle breathing. I'm going to follow your breath, and then we're going to do some traction in that direction.
What just cracked?
I feel like a new person.
I have been having a lot of pain in my lower back. One morning, my back kind of hurt. 2 hours later, I couldn't stand up from my chair. I fell. My whole back and leg spasmed. I could not move. The pain in my back was extreme, and I could not stand straight up. In my back, it was so swollen on my right side. They took x-rays and some MRIs. They had found out that I have degenerative disc disease in my L1, L2. I started noticing really sharp burning pain down the front of my thigh. So I couldn't put any weight at all on my right leg, and I couldn't lift my right arm. Right now I have shooting pain in my right shoulder and up into my neck.
Have you had any previous injuries to your spine?
No.
Do you still have pain every day?
Yes.
Well, the nerve roots of L1, L2 do go to the front of the thigh.
Every once in a while, I will get it into the knee and then into the ankle. It'll hurt.
Have you ever seen a chiropractor before?
10 years ago, I always had pain in my neck on both sides. When I raise my arm, I get a shooting pain that goes down the back side.
Do you get headaches?
All the time. I don't know what it's like to not have a headache.
Do you take any medicine for that?
I take ibuprofen and Tylenol every day.
Looking at the feet first, there is a little bit of supination on both sides. I don't see any deviation of the Achilles tendon. Knees look straight on. Looking at the hips, more swing on the right side. The right hip looks higher and it's swinging to the right. The left shoulder is definitely high. Slight increase in temperature here in between your shoulder blades. Tenderness here.
Yes.
Turn to the left. Left or right?
Left.
Left or right?
Left.
SI joint on the right. Left shows up short. Go ahead and push your legs out to the side. Do you have any pain when I push here?
Yes.
Swelling here, do you feel that? I'm gonna follow your breath down like this. When we get to the end right there, I'll give a little push like that. Deep breath in through your nose and out through your mouth. And one more deep breath in through your nose, all the way in, far as you can go. Sink in, let your shoulders sink here.
Felt amazing.
Take a deep breath in through your nose and out through your mouth. Shoulders relax, just kind of sink in here. Let your shoulders sink. Turn your head to the right. Turn your head to the left. Left ear to your shoulder. Right ear to shoulder. I'm going to bring your head over to the side. We're going to push in that direction like that. Breathe in, sink in. Let your shoulders just sink in. Digestive organ release.
I do it to myself all the time.
Okay. Breathing into your belly. All right, so you're breathing. I'm gonna use the towel. We're gonna pull like that. Nice and gentle breathing. Just let your breathing come back to normal now.
Oh my god. That was amazing.
Deep breath in all the way and far as you can go. Your head relaxes there. Good, one more. Legacy here.
Sometimes I'll have pain like in my back.
So you've never been adjusted before. How do you feel about it? Nervous?
Oh, yeah.
Excited? There's very little of pain, if any at all.
Work at a desk and I'm my whole desk ratio to where it's probably not good. I was a gymnast for very many years.
Do you exercise still?
I do a lot of yoga.
Okay, very good. Do you ever have any headaches?
Yes, monthly.
Are they period related?
Mm-hmm.
How far back can you remember getting the headaches?
It's been like a couple of years. I had eye surgery when I was a baby. My muscles weren't, I guess, strong enough.
We've got some ankle injuries. Any knee pain?
Yeah, both my knees. My hip feels like it's out of place. And I'm like moving, like you'll be able to hear my hips popping or like my knee popping.
You had scoliosis as a child?
I did.
There's a slight loss of arch here in your thoracic spine. Very even in temperature and tone. I can start to feel a little bit of the asymmetry here. These muscles are hypertonic. It seems as if there's a slight rotation in your spine here. We've got a short on the left. Push your legs out to the side. Push, push, relax. Do you have any pain, discomfort when I press here?
No.
So the left is short and then it stays short. Tender?
Mm-hmm.
I'm going to do a stretch of your spinal cord. as you breathe out, I'm going to follow your breath like this with my hands. And then at the end of your breath, right about there, we just push like that in that direction. Just let your shoulders and back sink in. You're doing perfect. This is going to be gentle. Was there any pain? Sinking in, just letting it all sink. Shoulders, hips. This time you're going to take a deep breath in, and then at the top of your breath, then we're going to push like that. We're going to bend the top leg. Bottom leg stays straight. I'm going to scoot you forward to the end of the table here. Nice gentle breathing. I'm going to traction your shoulders in this direction like that. Then I'm going to push your hip in that direction. Same thing. I'm going to be tractioning your shoulders. Deep breath in through your nose, not through your mouth. Turn your head to the right. Turn your head to the left. Bring your left ear down to your shoulder. Bring your right ear to your shoulder. I'm going to bring your head over to the side. We're going to come to right about here. We're just going to push in that direction like that. You're doing good. Right now, you're perfectly relaxed. I'm going to adjust the left side now. Same thing, gentle, gentle. Let your head sink into the table here. Tender. Let your head drop in. There's some serious tension in here that it won't release. This is a big deal. I'm really concerned about your toes. Push, push, push. Relax. Squeeze again. Hold your knees together. The ileocecal valve. Okay, this is the window in between the large and the small intestine. Here in the ASIS, the point in between these two is where we begin looking for the valve. Tender. Breathe into your belly. Pyloric sphincter 2 inches above. This is a diaphragm muscle release. Full spine adjustment. We're going to use the towel to traction in that direction, okay? Nice and gentle breathing. Whew. I think we can do another one. Deep breath in. Hyperextended elbow, wrist. You drink more water.
When I was 14, I fractured the right side of my lower back. Now I have some extreme sciatic pain. I also fractured my left hip.
Tell me about the fracture in your back.
I know that it was my L4 and L5. It actually affects all, like, it follows the entire IT band into the knee and then down to my ankle.
All right, so the pain goes down the outside of your leg.
It stops right at the ankle.
Do you get numbness and tingling in your toes?
Mostly just around the ankle area.
All right, and that's just on the right side, but never on the left. Do you ever have any neck pain?
A lot.
How often do you get the back pain?
It's nonstop every day.
How did you fracture it?
I was figure skating since I was 5. When I was 14, it just all of a sudden hit me. I was on the ice and I turned, I rotated, and all of a sudden I got stuck. and I couldn't move. So I had to like carry myself off the ice, and I was in a custom back brace for about 6 months.
Do you have any headaches?
Yeah, they can be really light to almost like a migraine, once or twice a week.
Looking at the feet first, some external rotation on the left side. Shoulders look close to even, slightly higher on the right. Very stiff, tight in the upper body, like your shoulders look really stiff. This upper right shoulder blade area is very rigid.
Yeah.
This seems pretty symmetrical. It does get damp as we get down to the bottom here. When we get down here, there's like this resistance. The left hip is significantly higher than the right. Do you have any tenderness here?
Mm-hmm.
Do you have tenderness here?
Mm-hmm.
Left or right?
On the right?
Pain there?
No.
Pain there?
No.
All of these muscles on the right here are trying very hard to stabilize your spine. Tracing this up, the glute fold is lower on the right, meaning possibly posterior inferior rotation on the right. And then looking from the top, the left side is flaring just a little bit. So possible ASEX or possible PIIN on the right. March in place now. There's very little movement here happening with the sacrum. I'm going to push into your sacrum now. Do you have any pain when I push here?
No.
Do you have any pain when I push here?
No.
Tender?
Yeah.
Right or left, which is more?
I think left.
Shorter on the right. Right short crosses over, becomes the long leg on the right. Tender?
Yeah. I'm going to follow your breath down like this. Let's try this one first. Sink into the table. Oh gosh.
Deep breath in through your nose and out. Lift your right leg up in the air. Now left leg. Harder on the right. We're going to adjust the SI joint on the right. Your shoulders relax. I'm going to bring your hip down like this and your shoulders in this direction like that.
Oh my god.
Gentle sinking in. I'm gonna bring this over to like right here, and just a little push like that. Let it all sink in.
Wow, that was really nice.
Good. Do some deep belly breathing. breathe into your side body here. Push my hands out. Out. In. Out. In. Out. Okay, push. Do you still feel the tension?
Nope.
Push, 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 push. Relax. Push, 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 push. As you breathe in, you're going to point your toes up towards us.
Pain all the way up the right side of my back that runs like up my neck. Some mornings I can't even move my neck to the side.
Okay.
I had a lot of hip pain during pregnancy and I had all back labor.
All right. Before the pregnancy?
No, but I was a gymnast and a cheerleader, so I've always had like lower back issues.
The right side of your back and up to your neck, that's relatively new?
Yeah, and I get migraines all the time. I've always had migraines, but they seem to be worse now. I almost feel kind of like I'm uneven.
Both hips hurt equally?
The left one kind of came and went with the pregnancy, but it was always the right side. It was consistent right hip pain.
Pain on the right side of your back. That goes all the way up to your neck?
Sometimes I get it in my shoulder. No tingling or numbness or anything like that.
Tell me about the migraines. How often are you getting those?
Probably twice a week.
How long do they last?
Hour, 2 hours. I've had those since I was like 14.
Do you take any pharmaceutical medications now?
Medical marijuana.
And you do that mostly for
pain and for anxiety.
You've been to a chiropractor before?
No, I crack like crazy.
Oh,
yeah,
self-cracker.
yeah.
Looking at your feet, you have a little bit of external rotation bilaterally. Shoulders look fairly even, and it looks like we have a high hip on the left. The hip swing is absolutely inhibited. It swings out to the right much more. Couple things change here when I go through this part of your spine. This is the only place where the temperature changes on your spine. There's a moist in your skin. There's tension in the spinal cord. Tender? Mm-hmm. Do you have any tension here?
No.
Here?
Yes.
L5. Here?
Yeah.
So the tenderness here is regional, so it's going through multiple segments. I'm going to slide this up to your glute folds, lower on the right, but a little bit higher on the left. And then looking from the top, maybe a little bit more rounder on the right. Possible PIEX right, ASIN left. Pretty symmetrical here. And I still see the left as being just slightly restricted compared to the right. SI joint showing left. Do you have any pain when I push like this?
Oh, yeah.
Forward swipe. Lift your entire right leg in the air. Now go left. Did you feel restricted on either side there?
More restricted on the right.
Left short stays short. Do you still feel that tension there?
No.
As you breathe out, I'm gonna follow your breath down, but let your shoulders relax here. And at the end of your breath, we give a little push like that. Sinking in, just let it all sink. Sinking in.
Wow.
A little bit different. You're gonna take a deep breath in and we're gonna push at the top of the in-breath. Let your shoulders sink as you breathe out. Lean back as you blow it out. Breathe, breathe, breathe. One more.
Crazy.
I'm gonna bring your hips down like this. As you breathe, we're just gonna stretch this way and we're gonna push in that direction. Breathing, letting the shoulder come up. I'm gonna bring you over to like right here, and then we're gonna push in that direction like that. We're gonna adjust the left side now. You're gonna let the shoulders sink, and I'm just gonna push in like that.
Wow.
Squeeze. Push your knees out to the side. Push, 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 relax.
It hurts my pelvis.
This is how we manipulate the organs of digestion. We start with the ileocecal valve here, and then also the ASIS, and then connecting these two lines tender.
Yeah.
Now the pyloric sphincter. Diaphragm release. I'm going to use this towel to support your cervical spine like this. All you have to do is breathe and keep your teeth together. And I'm going to use the towel to decompress your spine in that direction like that.
Oh! Oh my god. I just felt like a release of happiness.
Take a deep breath in through your nose. Push out against my hands.
I've never been to a chiropractor in my 21 years of life, and I've done all kinds of sports, and I have slight scoliosis, and I have unaligned hips, so I'm just always in all kinds of pain with my back and my neck and hip area.
What hurts the most?
Usually my back.
So when you say my back, where?
Usually up around my lungs and the back. Sometimes it spreads to like the lower sockets down here in my lumbar.
When were you diagnosed with scoliosis?
When I was really young. I probably had back pain since I was like 12 because I've done dance and stuff.
So when you have back pain, what do you do to make it feel better?
I usually just try and crack my back. I stand a lot for my job because I work at a restaurant.
Do you ever have any radiating pain into your legs?
No.
Do you have headaches?
Sometimes. I do notice I do get headaches when my neck is kind of stiff.
How's your mental health?
Fine.
Feet first, a little bit of external flare on the right side, and the knees actually following in that same direction. Left high shoulder, high right hip. Arches look okay on both sides. I'm going to start off with a very gentle scan on the top of your spine. Temperature assessment with the back of my fingertips. increased heat here in the concavity of the scoliosis. This is where all the heat is, up here between your shoulder blades. But your pain is a little bit more towards your...
Yeah, it's usually over there.
Any tenderness here?
Yeah.
March in place. There is restriction on the right side where the left hip swings forward more. Slightly lower on the right than the left. Looking from the top, they're even. But there's a little bit of a rotation here. The left gluteal fold is back further. Very minimal rib humping here. There's very little rotation in your scoliosis. It's just a lateral bend. Your pelvis is rotated just slightly this way. Category 2. Tender. Do you have any pain when I push here?
A little.
Here.
No.
I'm gonna follow your breath down like this, and then at the end of your breath, we give a little push like that. Shoulders sink in. Let the shoulders down. Let everything sink. Now left. Is one side harder?
The left.
We're gonna bring your hips down like this, and we push in that direction. Shoulders relaxed. Good. Same thing here, keep that nice and straight. Breathing, shoulders relaxed. Turn your head to the right. Now to the left. Bring your left ear to your left shoulder. Right ear to right shoulder. I'm gonna bring your head over to like right about there. And then from there we push in that direction, okay? Let your head relax and just kind of sink in. Gentle breathing. Hold your knees together. The ileocecal valve we locate by finding the umbilical, the ASIS here. And we start from there. Tender.
Oh.
Breathe into your belly. Pyloric sphincter. Nice, gentle breathing. Keep your teeth together. And then we're going to pull in that direction, okay? Oh my gosh. Oh, that scared me a little bit.
I've been having this ongoing issue with my hips. They seem very tight. I also have this issue with my shoulders as well. They feel very weak, and I actually went to a doctor like maybe 5 years ago, and they said I was born with weak shoulders. He just brought me to physical therapy to like strengthen them. But primarily the issue is like around the hip area.
Both sides equally?
Some days it's like one hip hurts more than the other, but normally it's both sides.
When did it start?
I want to say like 3 to 4 years.
Was there any incident, any accident, any injuries?
Actually, I did have a major like weight loss, maybe like 50 pounds.
When your hips are bothering you, what do you do?
I do yoga sometimes.
Is it from standing for long periods of time? Do you wake up in the morning with it?
It's very inconsistent.
Dizziness, nausea, vertigo. Shoulders high on the left. Looking at the feet, we do have some pronation, internal rotation. Looks like the right hip is restricted and forward motion. Very warm up here. You got some dampness here on the top of your spine, your thoracic. We definitely have some postural things here that we can talk about and work on. And that's all up here. Do you have any tenderness here? Here? All right, which is more, here or here?
Right side.
Turn to the left. Do you have pain here?
No.
You have pain that way?
No.
You mean your hip clicked when we turned you?
I felt a tightness on my left.
When you turned to the right? You're going to feel my fingertips in the back of your hamstring like this. I'm going to trace up to the bottom of the glute fibers. We're lower on the right, even from the top. Which is cracked? Your right
Hip.
again? Do you have pain when I push here?
Yes.
Here?
No.
I'm gonna follow your breath very gentle. Then at the end of your breath, we give a little push like that. Sink in.
Whew.
Let that out, sink. Right? Left. Harder on the left. I'm gonna bring your hips down in this position like that. Letting your shoulders relax. We're gonna bring the hip down and then push it in that direction, okay? Oh. Turn your head to the right, left. Bring your right ear down to your right shoulder. Let your head drop, let your shoulders drop. I'm gonna bring your head to right about here. We're gonna push in that direction like that. Gentle, just let everything sink in. Let this relax here, let your head relax. Not bad, right?
No.
Squeeze. We start with the ileocecal valve, so we find the umbilical, ASIS, connect the two. Deep belly breaths now. We just use this towel to support your cervical spine. Keep your teeth together. And I'm just gonna use this to traction your spine in that direction. Gentle breathing. Let this go. How do you feel?
Good, like a new person.